After vaginal birth, you will be bleeding. The bleeding will be like a heavy period. It can last anywhere from 3 to 6 weeks. It'll start off bright red, turn pink, and spotting into a brown color. If you experience any large clots or heavy bleeding after the initial bleed, or it starts to smell, then you should contact your primary healthcare provider. Remember to use a sanitary napkin instead of tampons until you visit your obstetrician in 6 weeks. Also, remember if you feel like you need to pee, that you go to the bathroom, because this can also increase your bleeding. To clean your perineum and stitches, your nurse will provide you with a plastic peri bottle. You can fill the bottle up with warm tap water and spray from front to back. Then you can use toilet paper to gently dry yourself off. Make sure to change your pad each time you go to the bathroom. Also, don't use any other products around your perineum at this time. If you're experiencing any foul-smelling discharge, your perineum is red, swollen, or you're having a fever, make sure to follow up with your family doctor. If you have not had a regular bowel movement during your stay in the hospital, you will have one within 3 days of giving birth. To avoid difficult or irregular bowel movements, make sure to have a diet high in fiber, which can include bran, whole wheat, fruits, and vegetables. Also increase your intake in water. Your nurse will also provide stool softener as part of your self-administrative medication package. Stool softener can also be purchased over the counter with the help of your pharmacist. If you have hemorrhoids and are experiencing discomfort, you can apply cold compresses or ask your nurse for hemorrhoid cream. If you need something stronger, you can follow up with your healthcare provider. Your hemorrhoids will usually disappear or decrease in size within 6 weeks of giving birth. After giving birth, you may experience changes in your moods and emotion. If you or your family feel like you're not coping well for more than 2 weeks, it's important to follow up with your healthcare provider. It's also important to refrain from sexual activity into your 6 weeks postpartum checkup with your healthcare provider. At this time, you can discuss methods of contraception. If you have any concerns with your bleeding, your pain, or anything we discussed in this video, you can always follow up with your family doctor, your obstetrician, or your midwife.